Greeting of the day, everyone. I'm privileged to welcome you all into the Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SDR Knowledge Foundation and powered by Raisoni Group of Institutions. A better life starts with a beautiful smile. We can see that our overall health is directly proportional to our dental health. Better dental health leads to a better health, and better health means a happy life. So, to solve our problem and keep our smile brighter, we have Dr. Divya Oswal, and we have our topic Healthy Dental for Healthy Life. I welcome you, ma'am. Dr. Divya Oswal, she is BDS PGDCC. She is consult dental specialist and having the experience of more than 7 years, and fellowship in Rotary Endodontist Canal, diploma in comprehensive child care, specialized in dental sensitivity. She has special skills in root canal treatment, tooth filling, braces, kid dental, and many more. Now, without any further ado, I would like to hand over to you, ma'am.
That was a lovely introduction. Thank you so much. So, moving ahead to a healthy mouth leads to a healthy lifestyle. As it is rightly said, that mouth is a gateway of all your health needs. You begin eating from here, all your body is regulated from here. And for eating, the most important is your mouth, your teeth, your tongue, your saliva, everything. So we will just go through a journey on how we can take care of it and what precautions, what necessary things have to be followed. So that's a brief introduction given by Ms. Me. So we'll go ahead with it. So
Yes,
basically,
ma'am.
oral hygiene and dental care. So for that, you should know your teeth, why you need a teeth. A beautiful smile will be strong enough uh, if you have proper dental hygiene and care. And it will and a lovely face will be shining up only if you have a pretty smile. Why you need to take care of your teeth and your dental health? This is the answer. You'll be surprised to know that 90% of your systemic diseases, be it your heart related, your diabetes, your immune malnutrition, everything is from your dental health. So overall, your dental health regulates your body health. Coming to enemies of your teeth. Enemies of your teeth in our terms and in your terms somewhere begins from plaque, smoking, your diet, in between snacking, that is your eating habits, intake of your aerated drinks, sodas, processed foods, junk foods, and most importantly, a poor oral hygiene. I'll be explaining these points very briefly so that and the concept is clear that what exactly damages your teeth. Coming towards plaque. As you can see, very much yellow patches near the teeth in this image. So basically, this is what plaque is, a sticky yellow layer around your teeth. And if this is not cleaned on time, this is not taken care on time, it destroys your bone, your gums, it leads to bad breath, and many more things. So this is the first and the most basic thing that you need to take care is do not allow plaque to accumulate in your mouth. And how that can be prevented is brush effectively and but brushing also has its own limitation. Its effects last for 3 to 5 hours. So what is better than blushing is flossing. Flossing is a very important thing that has to be followed. So what is flossing is basically this. It helps to clean your interdental areas, the spaces between your teeth, which is not usually cleaned by brushing. Tiny particles stays there. So if flossing is followed every day, your expectancy will be increased by 6.4 years. Your infectious diseases will be restricted because these areas will be cleaned properly. Coming to the second enemy, that's smoking. Smoking, as we know, has not only adverse effects on your mouth, but it affects your general body in general. So if you have a habit of smoking, then whether you blush, whether you floss, everything will go in vain. Stoppage of smoking is one of the important things that has to be followed. Moving ahead, oral health and its connection to overall health. So these are very few highlights that are there, that very few diseases that are known to people but don't know that they have a dental connection. Coming up firstly is heart attack, periodontal diseases, that is your bone health, the teeth near the gums. At an elderly age, teeth become loose. That is because the bone support goes off. So in that case, the periodontal diseases rise, and that has more risk of heart attack. It causes respiratory infection. There is a lot of particles that get accumulated, and if those particles, along with bacteria, are inhaled all the time through your mouth, through your nose, and that causes respiratory infection. Blood sugar level diabetes, as we know, is a major cause of, is a major concern that everyone is having in today's lifestyle. So if you have gum problem, if you have a bone problem of your dental health, then your blood sugar will never be controlled. Moving ahead, dental health and dental treatment options that we have. So why do we need teeth to chew, to talk, for your appearance? Now imagine you have a lovely face, but you do not have teeth in it. How blank your face would look. It won't be appearing. So definitely appearance also it is necessary. Maintaining healthy teeth and gums at any age is important for your overall health, because if you cannot chew well, you won't get nutrition well. If you cannot talk well, your social ability will be disturbed. So general health importance, like I said, to prevent all of these, we need a good dental health, that is diabetes, heart diseases, lung diseases, strokes, low birth weight, premature births, malnutrition. All these are related indirectly or indirectly to oral health also. Oral health plays an important role in all these problems as well. And if you have poor oral health, what all problems will be there? So there'll be chronic pain, as in once a dental pain starts, you cannot sit, you cannot stand, you cannot do anything. It is that severe. And if that pain prolongs for months, you will be your daily life will be disturbed to a greater level. Poor social relation, problem in speaking, learning, because you cannot concentrate anywhere. Entire concentration will go on your dental pain. Malnutrition, fatigue, difficulty in eating, bad breath, and common dental problems that everyone is aware of. I just brief on it. Dental cavities, bad breath, gum problem, toothache, abscess tooth, and hypersensitivity. In that, cavity is known by all, any blackish discoloration, food is getting stuck in your tooth, on your tooth, all that is dental cavities. Bad breath is if you have poor gum hygiene. Overall, there are a lot of spaces where food gets stuck, so there'll be lot of bacterial load in your mouth, and it will lead to bad breath. And bad breath, we know it is very difficult to stand, very difficult to face people with that bad breath. Gum problem, there is bleeding gums, pain in your jaws, loosening of teeth, moving of teeth. All this leads to gum problem. Toothache, if prolonged sticking of food, or dental sensitivity, as in sensitivity to hot, cold, is being just ignored of, then the tooth goes down, 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 the cavity goes down and leads to toothache. If toothache is also being ignored for a longer time, you'll get abscess tooth. So basically, what's this abscess tooth? At times, you've seen people with a big swelling that comes down here, anywhere on your face. That is because there's a lot of infection that has gone down from your tooth to your bone, and it is damaging the bone. And there is a lot of bacterial load. So sometimes people usually get fever as well if they have an abscess tooth. Hypersensitivity, difficulty in eating hot, cold, enjoying your favorite ice cream, or even having soups. People find it very difficult at times. So that is basically hypersensitivity. I'll be giving a gist of all these problems and what solutions we have for this. So first is dental cavity. As this image shows, this is a very bad decay that has really gone deeper. But dental cavity, so this is what we call a tooth decay or a dental cavity. So this is the major cause of tooth loss at all ages. And usually at an elderly age, there are more decays because refined carbohydrates. Currently, not just elderly, all people have a lot of decays at an early age, be it a 2-year-old kid or 20-year-old adult or anyone. That is because of your diet, refined carbohydrates, more of junking foods, burgers, pizzas. So all that refined carbohydrates, it sticks on your teeth and it damages your teeth for a longer period of time. Then intake of sweet food, drinks, all that have increased. Intake of sodas, Pepsis, Mirindas, juices. So all these contains a lot of acids in it, and more the time the acids act on your teeth, the more decay it causes. So, on a very basic level, how can we minimize decay? So, how do I prevent my cavities at and from a very early age? Firstly, substitute refined sugars and artificial sweeteners, as in from maida bread, you can switch to brown breads, multigrain breads, for example. So, substitute a refined sugars as much as you can. Refined sugar and artificial sweeteners should be avoided at all the times, be it eating chocolates or just taking up chewing gums. Gums that has sweeteners in it should be chewing gum should be avoided totally. Then use antibacterial mouthwashes that rinses off the bacteria, but that is a substitute only when you are out, when you cannot really brush your teeth. So it's a substitute that you can use, but it is not something you should follow daily. Brushing and flossing twice daily is definitely important. Brushing and flossing, these two are the major things that, if practiced on a regular basis, 99% of your dental problems can actually be resolved. But then it has right techniques, it has right ways of doing it. And if you follow them, definitely your tooth decay will be prevented. So, what is tooth decay? How does it happen? Is basically plaque, the food that we eat, it sticks on your teeth. And once it sticks for a longer period of time, there is bacteria coming for all over your mouth, all over your head. It sticks on your teeth. So basically, the sugar and the tooth, and the bacteria, the sugar and the bacteria together on your teeth, they make a party on your tooth and start causing decay. So how decay happens is the upper surface, that is your tooth enamel, starts wearing off. The tooth enamel is a structure on your tooth which is more harder than your bone. So it is very difficult to destroy it. But continuous attack leads to destruction, and once it begins destroying, so gradually, the decay begins. So what increases chances of decay is street food, fast food, sugar, soda, oily substances, all this. So once decay has been ignored, it will lead to toothache. When does toothache happen? When there are holes in your tooth, when there is infection in your tooth, when the neck of your tooth, where gums and teeth meet, there is a crack over there or there's a decay over there. Some people have a habit of grinding their teeth really hard. So grinding will lead to loss of your enamel, the top layer, and that will cause toothache. Sometimes even gum problem can lead to toothache. Outer enamel or the covering of the tooth is being removed by all these things, like grinding of your teeth, intake of a bad diet, very aggressive brushing, ignored holes on your teeth, that is ignored cavities. All that will further go down and lead to toothache. So what is the solution for tooth decay? So, like I said, the best solution is brushing and flossing. Brush your teeth twice daily, floss daily before brushing. Eat a very healthy diet, like dietitians say you should have a rainbow diet, which includes your salads, your sprouts, your uh, regular chapatis, one bowl sabzi, one. Everything has to be included in your diet, because all that just don't have your health importance, but it also has dental importance. Intake of fruits, vegetables leads to more chewing of your teeth. More chewing leads to more saliva production, and more saliva, if produced, it flushes off toxins from your mouth itself. Visit your dentist. A dental visit is must every 6 months, not for treatment but for a regular checkup of how your dental health status is. Is there any problem that has just started? Is there any problem that is worsening? All that can be monitored by your dentist. Having sealants placed. Sealants are basically a gel that is placed on your teeth before they cause decay. If your dentist feel that your teeth are very prone to decay, then this is a treatment that they will advise. A mouthwash is advised only if there is no brushing alternative present by your hands. Chewing on sugarless gums. Chewing gums that do not have sugars in it can be taken up if you are out, if you cannot just immediately brush your teeth after having something that is really sticky. Next problem is bad breath. This is a very much social issue that is arising nowadays because once you have bad breath, it is very difficult for you to stand, for you to talk. Your self-confidence starts depleting. So why bad breath happens is same bacteria are acidic in nature. So bacteria stays on your tooth and it causes very smelly tooth. And why does it happen if you do not brush floss every day? Then bacteria keep on multiplying, and once there's a colony of bacteria in your mouth, its byproducts will increase the smell. So, what is the solution for bad breath? First solution is tongue cleaning. Regular tongue cleaning is important. So, use a tongue cleaner every day. Professional cleaning that is done at a dental clinic is compulsory once a year. Secondly, do not allow bacteria to sit. If you are notice any sticky, hard layer around your teeth, it has to be removed, which can be removed only by professional cleaning. Dry mouth is one of the causes for bad breath. So dry mouth can happen with various medicines, systemic problems, or generally low intake of water. So you have to increase, be hydrated. And if you notice that you have a repeated dry mouth, there is a consultation is needed for you. If you have diet which is rich in fruits, vegetables, so they automatically will increase your saliva in your mouth. So how do you clean your teeth? I'll just tell you how exactly a brushing has to be done. So basically, you just don't have to move your brush like this, like this, like this. You have to keep your brush inclined on the outer surfaces of your teeth at an angle. And firstly, you begin from one area of your mouth to brush like this, then go on this area, and then the frontal area. Then that is done, just open your mouth, clean the top surfaces of your teeth. When those are done, then you have to also clean the surface of the teeth, which is near your tongue, that is the inside of your teeth. And once all this is done, then clean your tongue with a tongue cleaner. That is how the brushing has to be done. You don't have to brush very aggressively because that will again damage your teeth. And a mouthwash, if you all have a really bad smell or gum problem, then a mouthwash is recommended, but it has to be diluted. And after mouthwash, you're not supposed to rinse or put anything in your mouth for half an hour. These are just pointers that I just said about. Okay, how do you protect your mouth against oral diseases? Is good oral hygiene that is done by brushing, flossing twice daily. Limit your sweet intake. Reduce in between or stop in between snacking. So what is in between snacking is you have your breakfast now. After half an hour, you'll just have something more. After half an hour, you'll have something more. So the more you all have it in between snacking, the less chances the mouth gets to recover from the bacterial load that had happened earlier. So you all had your breakfast, and after that you'll drink your water and all, gargle nicely, and give your mouth some brief time for itself to recover and cleanse your mouth. If you all have anything again, so that will again stop your mouth from recovering and it has to fight new bacteria. So you have to stop in between snacking. Keep hydrating yourself. Water is very, very, very important. You all should keep sipping on water very frequently and biannually, as in every 6 months, a dental checkup is must. Gum diseases, there are numerous gum diseases, but I'll be just talking briefly about these two. One is gingivitis and one is periodontitis. Gingivitis is gingiva is the red part that we see. on your below your teeth, that is your gums. So infection to these is gingivitis, and periodontitis is the bone behind this gums. All the structures behind the gums is periodontitis. It is your bone, your supporting structure, the part of your body that protects your tooth. All that comes under periodontitis. So infection to gums begins first. That is, you'll notice bleeding gums, and then when you ignore that, so gradually it will go down and destroy your bone. That is periodontitis. And once your bone is destroyed, it cannot be recovered back to what it was earlier. Dry mouth, as I said, is a major problem. This leads to cavities. This leads to gum problem, dental problem, everything. So dry mouth has to be avoided. And some people have it genetically. Some people have it because of medicine. Because without saliva, your mouth cannot be clean, and the bacteria really cannot wash off. So what do we do when you have medication-related saliva? Is you consult your doctor to ask for a substitution. If your body still does not respond well, then there are salivary substitutes that have to be used. Then frequent sipping of water is very, very important. Finishing off 2-3 liters of water in a day is really important, but that shouldn't be done like you sit and you finish it. You should keep on sipping it after some intervals. Oral diseases, so cancer is also an oral disease, and it is rising in boom in today's generation, or generally in India, it is rising very, very at a very faster rate. So how do we notice that it is an oral cancer or we have started? Firstly, your habits rule oral cancer. If you have a habit of tobacco, smoking, drinking, your cancer will definitely increase. So this has to be taken into mind that you should stop all these habits. And if it is a chronic habit since a very long time, you need to get into counseling to stop it gradually, reduce it, and then stop it. Early diagnosis is crucial. So how do you know that you have oral cancer? If a person has a habit of getting ulcers in your mouth, and you get repetitive ulcer on one particular position, one particular place that could harbor cancer. Secondly, there are non-healing sores in your mouth. Some people, they simply have this tendency of developing ulcers again and again and again, or sometimes even a sharp tooth irritating your cheek, tongue can lead to cancer. So there are multiple things that leads to cancer, but something that is happening again and again, and it is not healing for a very long time, is the point of your concern, and you should get yourself checked. Okay, whether it will be troubling you in future or it is just localized or it's an acute thing, and but you should definitely get it treated and resolved. So presence of white patches, red patches, irritation in your mouth, lip, throat, all these are signs of cancer. Difficulty in chewing food or swallowing, numbness in your lip, tongue, soreness in your throat, pain in ear, but there is no hearing loss. All these are pointers for cancers. So you should examine yourself first on all these points, and then you should or you should consult a doctor as soon as you notice any of these symptoms, even for a very brief period of time. Getting a consultation done will definitely help you in long run. So coming back to tooth decay, that is the one thing. So tooth decay is of various types. So I'm just showing you that what all kind of cavities you can notice in your mouth. So first is pit and fissure. This is your tooth, just simple black lines. So these are also tooth decay, and these are the most difficult decays because at the top it just shows up as black line, and when you go down, it spreads like a mountain. So on the tip, you will always see one small point, but as gradually you go down, no, it spreads widely. So if you notice these blackness in your teeth, get it filled. Then there are smooth surface decays near your cheek, near your tongue. There are decay on the neck of your tooth. So these are cervical caries. These goes down directly into the bone. These are smooth surface caries, which is seen on your smoother surface of your tooth, that is your cheek, your inside of your tongue. Nursing bottle, this is usually seen in kids who are breastfed or bottle fed. So this kind of cavity rapidly spreads. So just ending the cavity thing. So do you know why do we suggest to avoid intake of sugary foods and drinks? So this is a basic thing that you should know. Sugary items help bacteria in tooth decay. So sugar and bacteria, they become one strong army, one strong enemy, and they start destroying our teeth. So the presence of sugary substances will lead to more colonization, more increase of bacteria in your mouth, and it starts demineralizing your tooth. That is, it starts destroying your enamel, your hardest part of your body, the tooth structure, and that is how the cavity begins. So, what are the dental treatments that can be done? So, for tooth decay, that is a filling. This is one of the most common procedure that is done. All the blackness that I just showed you, the patent fissure caries, the smooth surface caries, that all of that can be handled. So how it can be handled is getting your filling done. So what is basically a filling is we remove the cavity, the black part, the destroyed or the tooth structure that has bacteria in it. We simply take it off and fill the blank tooth area with a material that is biocompatible that protects your teeth and also replaces the gap that has been created by the bacteria. Second is root canal treatment. So everyone must have heard about root canal treatment, and it is very frequent that people get it done. So root canal happens when a cavity has been ignored. So once the cavity has been ignored, it goes up high. So when the cavity is here in the outer part of your tooth, this can be taken care of when it goes down, down, down near your nerve. So the option left with us is getting a root canal done. Root canal is done when a person experiencing sensitivity toothache. That means the cavity is gone deeper. Just a minute.
Yes, ma'am.
That means the cavity is gone deeper, and the filling won't save the tooth. So in that case, root canal is needed. So in root canal, what we do is we make space to clean the areas that are below the bone, that is the roots of your tooth. We clean it, we take all the infection out, we wait for the infection to subside if the tooth is really infectious, and then we fill it up with a biocompatible material. So after the root
Yes,
canal is done, the tooth is still weaker. Like if you take a glass, an empty glass, and you just it is just pushed off, or if you just even if you just bang it, it will break. And similarly, if we fill that glass with water, and then if we bang it somewhere, or if it falls off, there are chances that it won't crack because it's been filled now. It is not hollow. So that is how a root canal is. Once the root canal is completed, the tooth is filled at the bottom. There are chances, there are very less chances of it from cracking. But that is not enough because the top part of the tooth is still hollow. So what is the replacement for the top part that is cavitated? So replacement of tooth is done by multiple things. So once a root canal is done, you need a cap. That is what most of you must have heard. Cap or a crown, what we call this. So cap is basically a part that fits on your tooth. So that a tooth has been shaped and the appropriate measurement has been measurements are taken, and according to your measurement, we make the cap. The second option for tooth replacement is people who've got their tooth removed is bridge. So in bridge, we take support of the adjacent tooth structure and replace it. So next option is an implant in which a screw is directly inserted in the bone, and then a cap has been fixed on it so that the tooth that is missing has been replaced. The third option for replacement is dentures. People with no teeth or less teeth, and for the compromised bone health, these are the dentures that are usually placed. So crown is basically a single entity that is placed on a tooth. The size of the tooth is reduced, and your measurement is taken. and the cap is cemented permanently on it. Bridge is done to replace a missing tooth. That's a semi-permanent option, like I just explained. Dentures are the removable appliances that are usually put for completely edentulous, as in people with no teeth or which are people who have many teeth that are lost and their bone are strong, not strong enough to hold an implant. Implants are the latest treatment options that replace your tooth. So, implants are basically fitted screws in your bone and then a cap is placed on it. So, without disturbing the adjacent teeth, we replace the tooth. So, tips on, so I'm coming towards the end of my presentation. So, in that, we'll just brief you with tips that are required to maintain your hygiene on how you can prevent decay, gum problems, oral health, how you can prevent a bad smell. So brushing teeth twice is definitely important. Flossing is important. The technique I showed for brushing, if followed properly, will help maintaining the hygiene. Then cleaning your tongue with a tongue scraper is must. It prevents harboring of organisms. According to your way of brushing, your dental health, your dentist will suggest you that whether you need a sensitive toothbrush or a soft toothbrush or extra hard toothbrush. Hard is usually not recommended. It is medium, soft, or sensitive. That is extra soft. All that is suggested. A toothpaste containing fluoride should be used for adults. For kids, non-fluoridated toothpaste has to be used because kids have a tendency to swallow it, and always start cleaning from the outer ends, then the upper surface, and then clean the lower surfaces. Moisturizing your lip, gums is necessary. Screening yourself for any signs of cancer or any signs of problems in your mouth is must. Regularly dentist. Visit your dentist regularly, that is every 6 months. If you all have HIV or any viral infection, you should inform your dentist about it. And if at all you are using mouthwash, that is definitely not recommended to use every day. But if you are using a mouthwash, make sure it's an alcohol-free mouthwash. And one point I forgot to mention is you can chew on non-sugary chewing gums, but that is very occasionally when you are out.
Okay,
And
ma'am.
obviously, for your expert opinion, you should visit your dentist. That's a brief introduction about me, and that's my Instagram handle, where I keep on posting multiple health tips that is very useful for everyone. And just there are few cases of filling that I would love to show you all that how exactly it looks before and after filling. So this is all plaque and cavity in this patient's mouth, and this is how it looks post filling. Similarly, all plaque accumulation was there, and this is how your teeth looks only after one session post cleaning. This cavity was seen, all blackness, and in this we filled the tooth, so the cavity is gone. Thank you.
Ma'am, what are the symptoms of tooth infection?
See, symptoms of tooth infection vary a lot. So, the symptom of tooth infection can be simple toothache that comes and goes, or sensitivity to on eating an ice cream or anything hot, cold, or chewing hard substances is also a symptom of tooth infection. Whereas a large abscess or a large pus-filled area is also a symptom of tooth infection. Similarly, bleeding while brushing your teeth is also a symptom of tooth infection. So, anything that you feel is not normal, which is not comfortable, is a symptom of tooth infection in a way.
Okay, ma'am. Thank you, ma'am. Ma'am, what is root canal?
Root canal, as I just explained in the previous slide, when a cavity is being ignored and it goes down deeper in your tooth structure, and the sensation of pain begins. So that is when a root canal is recommended. So root canal is basically a treatment in that we take off the infected nerves, we take off the infection from that particular area of the tooth, We clean that tooth, we fill it with medicaments, and then once the infection is healed down, we fill the tooth with a material that stays in the tooth, which is a biocompatible material, and then we fill the tooth with a permanent filling material. That is what a root canal procedure is. And it is done under local anesthesia, as in the part of your tooth where the treatment has to be done is numbed before starting of the treatment, so that patient experiences very limited pain while doing it.
Thank you. Ma'am, what issue do the elder people face in terms of oral health care?
Coming to elderly people, oral health and systemic health goes hand in hand, as we just discussed. So in elderly, there are multiple systemic diseases that are already present. So they take medication for that. And with age, we know the bone become weaker. So first thing is their medicines cause a problem which causes lack of saliva. Second problem is lack of brushing also leads to it, because elderly people, they really have an habit of using tobacco or not really brushing every day with a toothpaste. They don't like the flavor of toothpaste, the mintness. So brushing is also an issue with them. So non-brushing also leads to multiple health problems. Intake of water, as we age up, the intake of water really goes low because we don't really feel like eating, drinking much. So when the intake of water is low, all your infection rises to a peak higher. Fourthly, with their bone health going down, similarly in our teeth, this the part that we feel hard here is all bone. So once this bone health goes down, so your teeth starts loosening, they'll start shaking off. So that is also a problem that they face. And the tooth ages because we use teeth every day for chewing, eating. So the bacterial load, if not taken care of on time, will lead to destruction of tooth cavity, root canals. So all this is usually seen in elderly people. That compromised bone health is the first thing. Dry mouth is the second thing that we see. And third is the aging of the teeth.
Yes. Ma'am, what is tooth sensitivity and why does a person get it?
Okay, so tooth sensitivity, one of my favorite topic and the most common concern for which people don't consult a dentist. It will subside down. So sensitivity is now if you have a healthy tooth, healthy mouth, you drink cold water, it won't affect you. You eat ice cream, it won't affect you. You can sip on your favorite coffees, teas, it won't affect you. But sensitivity is what when you just even try to eat an ice cream and you feel that coldness that you really can't take it. So that is sensitivity. So not on an extreme level, but even beginning of it is sensitivity. Sensitivity is you feel the sensation hot, cold on your teeth. Ideally, the nerve of the tooth is so well protected that you don't really feel anything very hot or cold. And why does it happen? There are multiple reasons. First reason is abrasion. So what is abrasion is very aggressive brushing. So when you brush aggressively on your teeth, either with a hard brush or you put too much pressure while brushing, it destroys the upper surface of your teeth. And once the upper surface, the protective layer has been destroyed, the inner layer, a sensitive layer, and the nerve layer. So your sensation begins. At that point, you start experiencing hot, cold. Second is erosion. Erosion happens in chronic acidity patients who have, or people who have habit of drinking too much soda. Soda is highly acidic, so it dissolves the upper layer of the teeth, it demineralizes the tooth, and this will lead to sensitivity. Cavities. If you have cavity, automatically your upper layer is gone. The lower layer has been exposed, so that will lead to sensitivity. In your gum problem, when your bone level goes down, the root, the part of your tooth structure that is behind the gum covering is opened up. And at that point also you will feel sensation of hot, cold. So all this leads to sensitivity.
And what precautions should be taken to prevent decaying of teeth?
Uh, like I said, and I would always say flossing, brushing, use of fluoridated toothpaste, and limit your diet and limiting in between snacking and soda. If these five things are properly followed, it will definitely decrease the chances of getting your tooth cavitated. But they have to be thoroughly followed. And whenever you eat anything, make sure you have a habit of rinsing. If you have a habit of eating too much of junk food, make sure that you brush immediately. If brushing is not possible, you eat a piece of carrot, you eat a piece of citrus, fruit, apple, because all these are natural cleansers. It will not cleanse 100%, but at least more than 30-40% it will cleanse your teeth, and that will reduce the chances of teeth cavity.
Ma'am, can you share your funny incident of patient with us?
Oh, the funny incidents. There are n number of incidents, but one of the funniest is there was a patient for whom we were doing an anterior bridge. Anterior bridge is in the patient had lost most of the teeth on her front side because of the cavities, and we had a trial of her denture or of her bridge to see whether it is fitting well or no. So we just placed the bridge without any cement or anything. We placed it, and we I turned around to give her the mirror, and she nicely smiled. So as soon as she smiled, the temporary thing that we had fixed it just came off, and she got scared. Oh my God, my teeth don't look like this anymore. So and it was a very funny because. Uh, we were trying to give her a happy smile and she just saw the cut tooth, which are very tiny. But then it was later on sorted off and we got the permanent things done.
Okay, ma'am. It was pleasure meeting you, ma'am. Thank you for your precious time. Thank you.
Thank you.